So welcome everyone to my channel. In my today's video I will be demonstrating you how you will perform radiocarpal volar glide mobilization for the patients who are having wrist joint pain, wrist joint stiffness. So let us start with the practical demonstration. So to start with the practical demonstration, so let's say take an example. This is the patients who are having pain in the wrist joint of the right side. So how you will mobilize the radiocarpal joint? So you have to place your stabilizer hand on the distal radioulnar joint to stabilize the arm, and the patient arm is supported on the thigh of the therapist. Now from the mobilization hand you have to grab the wrist joint, distal wrist joint, just over the proximal carpal row. Now you have to take all the slack in distraction method. Now you have to apply a volar glide in the downward direction. So what are the steps? You have to stabilize the radioulnar joint, and you have to grab the distal wrist joint just over the proximal carpal row in this manner, and you have to take up all the slack and give a downward volar glide to the wrist joint to the proximal carpal row, and ask patient to do radial deviation and ulnar deviation, radial deviation and ulnar deviation. Now flexion, now extension, or which movement is affected, you can take up the example and perform the same movement. So again you have to grab the proximal carpal row, take up of the slack, now apply a downward volar glide. Now ask patient to do a offended movement. So let's take up example. This patient has limited radial deviation movement, so we have to take the wrist joint proximal carpal row into the volar glide, give a volar glide, a downward glide, and ask patient to perform radial deviation, again radial deviation, again radial, and relax. Now once you do that movement, now you have to proceed for the next step. Now again you have to take up of the slack, give a glide in the volar direction, and ask patient to do radial deviation. Now you have to ask the patient to push or give a force towards the ulnar side. So आपको अपने हाथ से राइट साइड मूव करना है और पेशेंट इसको रेजिस्ट करेगा. थेरेपिस्ट हैज टू रेजिस्ट द अल्नर साइड मूवमेंट एंड रिलैक्स and increase the ranges. Again you have to push towards the ulnar side and relax, more ranges. Now again and relax. So you have to give a volar glide, take the wrist joint into the radial deviation of available range. Now ask patient to push towards the right side, ulnar side, and relax, again and relax. So this will how you will increase the radial deviation ranges in the wrist joint. So try this technique in the patients who are having the wrist joint pain and wrist joint stiffness. You will get definitely a good result. So stay connected with us and give us your valuable feedback in our comment section. Till then, stay connected and thank you.